If you're someone out there suffering from symptoms due to concussions, it might be a current concussion that you have right now, and you got all these symptoms. It might be something that's lingering, right? It may be something where doctors have cleared you and you think you're ready, but you know deep down that there's some hidden weaknesses. Well, I've been in practice now for decades, and this is one of the things we've worked on is concussions. Concussions aren't just brain injuries, right? They're nervous system injuries. And the way we look at concussions is radically different. And in my opinion, we get to the root of the problems with these particular injuries. So if this sounds like something you're interested in, stay tuned. We have a nice interview where you'll get to learn so much about concussions that you didn't know.
Today I'm here with Dr. Chris Cormier, and we're going to be talking about concussions. Hello, Dr. Cormier.
Hey, Cameron.
To start off simply, what is a concussion?
So a concussion is when your brain shakes and things start to shut down. And the way I'm going to describe a concussion is probably different than anybody's ever heard, but literally that's what it is. So it could be any type of injury that you get where the brain shakes and then things start to shut down.
Can a concussion happen without actually losing consciousness?
Yes. Remember, it could be falling on your butt, but your brain shakes, right? It doesn't necessarily have to be hitting your head. You know, that's a misconception. It can be certainly hitting your head, but it's literally the shaking of the brain that causes. The best way I'll describe it is your brain is here. It's your power company for trillions of cells. That's hard to imagine. So your brain and spinal cord are here. There's 88 primary nerves. They start coming off the spinal cord on either side. There's 44 pair. They start back here. They go all the way down to your butt. There are big power lines that come off, and those big nerves, they branch all the way to microscopic cells. It's just massive network that we're walking around in. And so you can imagine those 88 major nerves are like breakers in a breaker box. And if you fall on your butt hard, you could turn off some of those breakers. And maybe before you fell, some of those were weak and you didn't know it. So then the injury is potentially worse.
Why do some patients recover quicker than others would with a concussion?
Because their nervous system was stronger prior to the injury. Okay, so think about it. You got this brain and it's trying to stay powered up to 30 trillion cells. That's hard. It's impossible in today's world. And so to make it even simpler for people, our bodies are God-made and they're designed to self-heal. So every one of your trillions of cells, every single one, if it's working at 100%, it's going to heal fast. So like if you get a cut on a healthy group of cells, it's going to heal and you're not going to see a scar. But if you get a cut on some unhealthy cells, it's going to take longer to heal and it's probably going to have a scar. And if you get a cut on really, really unhealthy cells, it may not heal. It's the same thing with these types of injuries. You want to think of it as nobody is born with a perfect set of cells. Nobody. So that means every person on the planet, we all have genetic defects. Every person starts with their self-healing capacity, the ability for the cells to heal themselves, less than 100%. Every person. Then from the moment they start living on planet Earth, there's physical stresses, there's emotional stresses, there's environmental stresses. The environment's unbelievable nowadays, so much. We don't even think about 5G going on 10G, Wi-Fi, chemicals, pollutants, toxins, additives, preservatives, so much, right? I think I heard a study that there's a professional football team, and they're noticing they're getting injured more and more and more. And I think there's like a power plant real close to the practice facility, and people are starting to pay attention to some of these things now, and that they weren't paying attention to before. And so I'm not pointing the blame just on the power company by any means, because there's so many different interference stresses that are affecting our cells. So the point in making all that is the more of your cells in your body that are not healthy, that lose power connectivity, then all of a sudden you could have a small injury and end up with a major concussion.
That's crazy. Why are people often told that their scans may look normal, but they don't feel normal?
Yeah, so the nervous system, there's a misconception for people. You know, when you do a big scan, like a big MRI, for instance, you're thinking that it's going to show you damage to the nervous system, which it can, right? It could show you if there's a tumor, It can show you maybe if there's some type of lesion affecting the nervous system. But one thing it does not show you, in my opinion, is the most important, is energy flow. So the nervous system, if I'm going to move my finger like this, for instance, okay, this side of the brain is sending energy, light energy, down through the spinal cord into my C7 nerve here that puts power, that sends light, fiber optic light, into my finger muscle, into the muscle picking my finger up right here. It's crazy to think about. And then, you know, like common things with concussions, for instance, you know, people get blurred vision, they can't see, I mean, their eyes are all like this, and they get nauseated, right? So the vision part can be from weakness through particular nerves. So there's nerves that make you look up, nerves make you look down, to the left and right. Those are called the abducens nerves and the trochlear nerves. They're cranial nerves that are located, ironically, back here. This brainstem has 13 pair of the most important nerves in your entire body. And so that's why, like when you have an injury like this, your eyes get wonky because the power, the injury happened and then the power went out. It's like a breaker to your eyes, right? And maybe they want to get nauseated and throw up. Well, there's a nervous system or nerve that actually controls the nerve that makes you swallow, or controls the way you swallow. And it's called the glossopharyngeal nerve. It's a big nerve, but it basically makes you swallow. So if that nerve gets turned off or weak, it'll make things want to come back up out of the GI. And so there's also other nerves where they get ringing in the ears or they lose balance, right? Those nerves, that's called the vestibulocochlear nerve. It's cranial nerve 8. It's located back here. And that nerve is called vestibulo, meaning it makes you balance. Cochlear means hearing. So there's a nerve that makes you balance and hear. And if that nerve gets thrown off where it's not, the energy flow is not flowing, of course you can lose balance. Of course you can lose hearing. There's many more nerves we could go into, but those are just some of the common ones we see.
What happens when someone is like cleared to go back to work or practice to play their sport or whatever? What happens when they're actually not fine, but they're cleared to go do these things? So
somebody that's not properly trained in the nervous system, which there's not very many of us, I think, in the world that have been doing this for decades. And so each nerve is so important in the body. I mean, it's so important. And so any type of concussion type injury can knock off nerves, not only located back here, but could be anywhere throughout the body. And, you know, to the untrained professional out there that's not dealing with all the major nerves in the body, and they're just seeing that the person maybe was wobbly and now they're not as wobbly, or their eyes were, you know, not right, their vision wasn't right, and then that's better. But maybe it's an athlete, right? And they just say, oh yeah, you're good enough. But the athlete themselves knows it's still not 100%, but they still kind of just go. It's not a good scenario at all, because a person with a weaker nervous system is more likely to get damaged than a person with a stronger nervous system.
A lot of people with concussions have issues with bright lights, loud noises, possibly busy environments. Why is that the case?
Exactly what we just talked about. So there's nerves, like I didn't talk about one nerve, this nerve called the optic nerve. And it's basically back here again. The optic nerve is cranial nerve 2. So it basically goes to the eyes and it makes you sense light or see light, for instance. And so it controls your actual pupil to where your pupil, if there's a big bright light that comes in front of my eye, my pupil should constrict. There's a nerve that powers the little muscles that make my pupil constrict so that I'm not getting that bright light in to potentially damage my eye, if that makes sense. But then there's, with this particular injury, concussions, you can damage that optic nerve and then that doesn't work properly and then they can't tolerate very much light. So sounds are the same way. We kind of talked about the vestibulocochlear nerve being problematic. Oftentimes people with concussions, they can't even take any color light or sound, just irritates them so bad because it's like that nerve can't do its job. It's very similar to the nerve that goes to the bicep, right? If that nerve is weak, well, you're not gonna be able to pick a 100-pound dumbbell up. Same thing with the nerves to your ears. If they're not powered up properly, then any tiny little bit of sound can irritate you, right? It's just you can't tolerate very much. Same thing with the eyes.
When someone with a concussion walks into your clinic, the Nerve Health Institute, what is the first thing that you would do?
First thing we do is a very detailed history. we always talk about cells in the body, right? And so when a person starts on planet Earth, like we talked about, they're given this God-made body, and the cells in your body are already designed to heal themselves. It's called self-healing. So nobody's born with a perfect set of healthy cells. So everybody starts with weaknesses where their self-healing is not at 100% from the moment they're born. And then as they go through life, they have physical stresses, emotional stresses, environmental stresses, and those stresses cause those nerves to potentially shut off. So when we see a person come through our office, we want to know all that history. Like outside of the concussion that they think, there's other factors that led up to it. Environmental things, potentially, stresses, physical stresses that they've had in the past, and emotional stresses. Then we actually go through a very detailed neurological exam where we actually examine each one of the 88 major nerves coming off the brain, powering up all these trillions of cells. And so we're able to tell, like after this detailed exam, what nerves are off. And the brain actually, just through the testing process, starts a corrective process. It's like notifying the power company of all these power outages. So once you do that, then the brain actually starts to heal. And then once we go through that original process, we form a corrective plan to get them back. Let's say we test them and the nervous system out of those 88 nerves is 30% connected. We want them to be at least 85%. So we go through a corrective plan where we're teaching them what to do to help themselves, but we're also using all our high-tech technology here. And not only do we do the nervous system testing, the resetting of all the nerves, but we also do oxygen. A lot of times with these types of conditions, you got to get oxygen back to cells. That's number one. And we got to make sure they're hydrated. We use all kinds of devices for home with this condition as well, for frequency. And basically it's a cumulative approach, but we're trying to get people to get their bodies to self-heal at the highest level possible. And then that ensures that they're not going to have multiple ones with small injuries down in the future.
What happens for a patient when their self-healing is finally brought back? Like, what does that feel like for them?
Fantastic. It's always tell people that if they're self-healing, their self-healing ability in 85% of their cells, trillions of cells, if 85% of your cells have 100% self-healing ability, they're not going to come in office. The likelihood they're going to get a concussion is very low. And if you think about it, there's a lot of people that play and they take massive hits over many years and you don't see any major signs with them. And you could take somebody right next to them and they just take a small hit and they have a major concussion. That's the difference, is the self-healing capacity in the body. Where is it? Is it high? Is it low? What factored into bringing that self-healing down? We got to fix all those things.
A lot of post-concussion symptoms are often blamed on like anxiety or stress. Why is that kind of a misunderstanding?
So remember, it's complicated. What we put our bodies through, most people just assume that it's physical. Only physical stresses can cause problems to my body, but that's not true at all. It could be any emotions that you go through. Emotions are such a roller coaster, right? It could be something really bad, like the death of somebody close to you, that damages certain cells. And if you don't know what to do to repair them, it's a problem. There's also small emotional stresses that can damage things. And then, you have environmental stresses, which we already talked about. It's just massive. That whole category is massive nowadays. And then you have all the physical stresses on top of that. So it's a lot of different things that can damage cells to the point where it leads to a small injury that leads to a big concussion.
What happens when concussions are only treated as a brain bruise instead of like a whole nervous system issue?
Drives me crazy when they just say, sit around and rest, don't see light, don't do any sound. That is actually, in my opinion, you're waiting on your body to try to turn on breakers itself. You're waiting on your body to try to rejuvenate itself. And sometimes it can, and other times it won't heal all the way like it was. But remember, your body is designed to heal itself. So if you do things that accelerate your body's ability to heal itself, that's where we're trying to get that internal self-healing capacity at a maximum for people.
For the opposite of what you're saying, why can pushing through the symptoms sometimes make your recovery take longer?
Yes, so if people are, let's say, really sensitive to light and they're really sensitive to sound. We see this pretty often. It's nerve damage. And if you take something like we mentioned earlier, just somebody's really sensitive to light, and we just put them in a room full of all these flashy, like let's say we put them in a theater or something, it's so big of an exposure. It's like taking somebody who can't lift a 5-pound dumbbell and putting a 1,000-pound dumbbell in their arm. Of course, it can do more damage. So just muscling through this is not the route at all. You definitely need to seek somebody like us who knows exactly what nerve goes where and how to check it, how to restore the connections, how to get the cells healthier.
Many patients and athletes feel supported early on when they're in clinic, but sometimes when they go home, they don't feel that as much. Why is that the case, and how could we help them to feel better when they're at home as well?
So we have Nerve Health Institute, and that's our clinic where we see people from all over the world that come to see us. Really cool. But that wasn't good enough for me. I wanted to help people at home. So not everybody can come to the clinic. And even people that come to the clinic, we want to ultimately teach you how to take care of yourself better where you need us less. Yes. And so we built Body Chargers, which is our online platform, and it teaches people what we use at home. It's a full teaching platform where you can you learn about all the devices we use for home, all the methods, all the techniques, and everything is centered on getting your body to do self-healing at a maximum.
How does Body Chargers help patients build awareness of their nervous system on a day-to-day?
So everything people are doing on a daily basis matters, and in a good way or a bad way, right? So it could be some bad food that you're ingesting routinely that has effects. It could be a stimulating drink, right? It has bad effects. It could be anything that they're doing in their environment. So from our perspective, we want to teach people progressively better daily habits in order to help themselves. So with Body Chargers, we have a 28-day cell sparking challenge we came up with, and every single day it's teaching them little things that they should be doing that they're not aware of. And it all centers on basic ingredients. We talk about oxygen being number one in the human body. It's the number one ingredient. So you got to replenish it because nobody breathes enough and we don't know what we're breathing anymore. So groups of cells lose oxygenation and get sick. So we have ways to help them with that. We teach you all about water, right? And there's so much to water that people don't know about. That's what this daily, the Cell Sparking Challenge does. And then also it's light energy. We don't get enough light energy. People don't know enough about light energy, so we teach people all kinds of strategies there. There's also strategies for frequencies and all these different things people need to be doing on a day-to-day basis.
Is it beneficial for a patient to go onto Body Chargers first before coming into the clinic? And
it is.
So why?
Yeah, absolutely it is. And in fact, that's why we invented it. We want people to have access to all these things. I've been down all the rabbit holes. I've literally, we have millions of dollars of stuff here in the clinic. I can't tell you the amount of things that I've used on my family for many, many years. And we've gone down all those rabbit holes and found the best of the best of the best things to help you at home. So that's what we have this platform for, is not only for you to have certain things that you can get, but it's also just knowledge, right? Education, understanding your body, how God made it, and then understanding what you should be doing to take care of it at a higher level.
We have there's a lot of elite athletes all over that have gotten concussions before, that are usually getting what we call like state-of-the-art treatment by these facilities that they have. Why do they still get more concussions or still have symptoms after those concussions? Because
they're not fixing this stuff we're talking about. And there's very few of us in the world that are doing this. And so, and I'm not exaggerating when I'm saying that. It's been one of my passions. My wife and I have 3 kids. They're all athletes. I cannot tell you how many concussions we worked on. It's unbelievable. It's in the thousands. And we've seen some of the craziest things you'd ever imagine with concussions. But from that standpoint, it's so important, especially if you're an elite athlete and you're making millions of dollars. Your health is everything, right? And even if you're not making millions of dollars, still your health is everything, right? Because if you don't have your health, you don't have anything. And so where we are is trying to keep people as healthy as possible for as long as possible so that they can make as much money as they want to make and do all the things they want to do.
In your clinic at the Nerve Health Institute, what is a complex concussion case that you've seen?
One of the worst ones I ever saw was a 10-year-old boy. that I got a call from the coach. I'll never forget it. And he was on a football field not far from my clinic here. And they were just doing practice, and he took a small hit and he started getting tingling all over his body. They rushed him to the ER. His mom was a neurosurgery nurse. And by the time they got to the ER, which is only like 5 minutes, he was paralyzed. Oh. So they ran him through all the tests. All the MRIs were perfect. So the surgeon said, I think they brought him to several surgeons and they didn't know what to do. Mm-hmm. They just said, yeah, maybe light PT. They didn't know what to do. The MRIs looked perfect. There was nothing pushing on any nerve. It's exactly what we talked about. The energy flow had shut off. So they came here. We did exactly what we do. We went through all the nervous system. We had the boy running in 3 days.
That is amazing.
Yeah, it sounds unbelievable, but it's not. It's not. We actually have footage that we took for it. And that was, oh my goodness, probably, I think the kid's in college now. So that, it was probably at least 8-10 years ago. And so we've seen so many really, really bad ones. I had another buddy of mine one time. He had a pipe wrench. He's a big, strong guy, and he pulled down on a pipe wrench and it hit him in his head. It kind of knocked him silly, and he was by himself. He was at work. So next thing he knew, he couldn't see real good. He would see like 4 dimensionally, couldn't hear, couldn't even drive, couldn't lay down, couldn't eat. And so he waits 2 days to come in. And by the time he came in, I literally did an exam on him and found a ton of neurological weaknesses. In an x-ray, his skull was fractured. Oh. And we saw his skull. That's how hard that pipe wrench hit him. So we sent him for a CT just to make sure he didn't have a brain bleed. Luckily he didn't. But we literally, in that case, within a week and a half, had him. I don't think he ever skipped work. We were able to get everything back completely functioning. And he's done videos to talk about it as well, but on YouTube that we have. But we've seen so many. I can't even begin to tell you how many on the field concussions we've been able to fix. My son played college football. My daughter dances in college. I have a younger son that still plays football and sports, and we've just been blessed to fix so many.
It's amazing. A lot of people get concussions around the world. What is the most damaging sentence a patient could hear?
So that you have brain damage, and it's going to be forever, right? Or the CTE, the chronic traumatic encephalopathy people talk about, where the brain deteriorates. Like some people, if you're an elite athlete out there watching this, you may think, hey, I'm just going to get this particular condition. I mean, there's a movie about it, right? In that particular movie, basically they talk about how the brain just deteriorates with too much trauma. Well, in my opinion, remember, it's all about maintaining health to cells. And so if you sit and watch it, think about your brain right now. It's stuff we're consciously having a discussion here, but subconsciously my brain is doing so much with all these cells. It has to stay connected. The more the cells get disconnected from the brain, the self-healing capacity in the body starts to go down, right? And these basic ingredients are just so important. We talk about oxygen, we talk about water, we talk about light, so important. And if you're not maintaining those ingredients, then this self-healing level in your body dwindles down. And then certainly if you're not doing the things we're talking about, you end up with this CTE condition. And some people, I think there's been like multiple NFL players where they've committed suicide as a result, because their bodies are crying for help, but other people may not know what to look for. And we know exactly where these hidden weaknesses are in the body, how to check them, how to restore them and get function back.
Well, thank you very much, Dr. Cormier. That was absolutely amazing. That does conclude our talk today on concussions.
If you enjoyed this discussion, and this sounds like something that you have, and you're open-minded to new methods of working with this condition and getting to the root causes of the problems and being able to fix them. Well, we have 2 routes. We have Body Chargers is an online platform that can help you. And remember, our focus with Body Chargers is to help you at home. So we want to make your body do a better job of self-healing. And so we have all kinds of devices and methods and techniques that you can do from home, even small daily habits that you can do, as well as if you want to take it more advanced and come to the Nerve Health Institute, which is our clinic. We can do a much higher level with all of our tech here and then we'll recommend things for home. So I hope this helps. I hope you enjoyed it, and we look forward to giving you any help that you may need.